If healthcare workers were providing misinformation, then there would be a new parameter that basically coworkers or the public had an obligation to report them, and that they would be determined to be unfit for practice. There are new disciplinary measures involved, 6 months in jail, up to $200,000 fines. And so currently what we are experiencing is the government is taking over the governance of healthcare. There has already been significant censorship and control over physicians and what they are allowed to say. And many physicians have faced having their licenses removed because they have tried to protect their patients and have been told by the government that they do not have that right to do that.
On the heels of getting its new premier, David Eby, the province of British Columbia seems to be quickly ushering in a new one-to-rule-all agenda that many of the citizens who are paying attention are not eager to be living under. I'm currently working on a few reports that will highlight some of these questionable provincial changes, but today I'll start with just one, which is focused on our already crumbling healthcare system, and that is the recent passing of Bill 36. Drea Humphrey here with Rebel News, and as some of you know, British Columbia follows its own science when it comes to things like dealing with COVID-19 and how to live your life through it. Unlike most everywhere else in the world that understands the fact that whether you're jabbed or not, you can spread COVID-19, the province of British Columbia is still punishing unvaccinated healthcare workers by the thousands and ultimately their patients that they could be serving by banishing them from working in certain healthcare settings such as hospitals. But if you've been following my previous reports on the medical madness in BC, you would know that there is one sector of healthcare workers that narrowly escaped the mandated wrath of unemployment by BC's unelected Health Lord Dr. Bonnie Henry in partnership with the Minister of Health, Adrian Dix. And that is the many regulated healthcare workers, such as your chiropractors, your optometrists, naturopaths, and also some of the vaccine-free physicians who can't save your life in the hospital, but thankfully have been able to care for some British Columbians in their private clinics. Doctors like Port Alberni's Chris McAllister, who despite being one of only 2 pediatricians in the city and sick kids having to be flown for care elsewhere because of his absence, is in a fight to preserve his hospital privileges indefinitely as health bodies try to take them away from him because he's allegedly not fulfilling his hospital duties, even though it's illegal for him to do so. Now, you can help cover the costs, the legal expenses of Dr. McAllister's fight by opening up another tab and going to our special website. The Democracy Fund has taken on his case at no charge to him. So if you go to saveourdoctors.ca, that's how you can help Dr. McAllister and other doctors he represents. But there's something else you need to know about British Columbia and other doctors like him who work in clinics and, as I mentioned, regulated healthcare workers. And that is because of the quick passing of Bill 36, people like them might not be able to serve British Columbians for long. Bill 36 is the Health Professions and Occupations Act, which will officially replace the Health Professions Act. Its first reading was on October 19th, and despite having a whopping 645 sections to consider, something that MLA Mike Bernier said he didn't recall ever seeing in his 9 years of sitting in the House, it was passed on November 24th. Now, the new law will make sweeping changes affecting at least 100,000 of healthcare workers in BC and how their profession will now be regulated, in particular, moving away from their self-governance for licensing from mostly medical professionals to now being under the rule of the BC NDP government's politicians, like Mr. Adrian Dix. Imagine how much easier it would have been to usher in the vaccine mandates or other political policies for the medical professions in BC, who Dr. Bonnie Henry backed down from mandating earlier this year, if this sort of law had already been in place. Now, I'm going to bring you an interview in just a moment with a former ER nurse named Corinne Morey out of Nelson, BC, who would love to be saving lives in British Columbia hospitals, but can't because she hasn't bowed down to the government's coercive vaccine mandates. She's going to further explain some of the concerns she and some of the other health professionals that she represents have with this law that was just passed hours after I did this interview with her. And she's also going to mention some of the severe punishments in store for healthcare professionals who dare to break this law.
The structure of healthcare in BC right now is that every profession has their own governing body, licensing body. So dentists have one, nurses have one, physicians have one. So there's currently 24 that are in BC. And these are all independently governed with their own board of directors. And the agenda now is that the government is going to amalgamate all these colleges down to 6. They are going to remove all of the board of directors from each governing body, and the government is going to take over the governance of these licensing bodies, and they will be appointing new people to oversee this. In the process, they have now introduced this bill, which has over 640 items in it. The complications are there's a lot of ambiguous language in it. There's a lot of concerning details. And the opposition has, for the last week, been trying to go through each item to get clarification on what the NDP is actually intending for this bill. And at this point in time, the communication that's coming to us is there are currently, I think, around 120 of the items, and NDP is intentionally going to shut down any further communication about this and push through a vote. Now, there are some things such as employers will have immunity from firing employees, which means if they have fired all these healthcare workers, if they at any point bring them back, they do not have to be compensated or have any kind of restitution given to them. There's also the introduced language. And when I watched actually a live legislature committee discussion night before last, and Adrian Dix himself stated in this, Shirley Bond had asked him for an example to clarify. And so he brought up the topic himself of mandatory vaccination, and that if healthcare workers were providing misinformation, then there would be a new parameter that basically coworkers or the public had an obligation to report them, and that they would be determined to be unfit for practice. There are new disciplinary measures involved, 6 months in jail, up to $200,000 fines. And so currently what we are experiencing is the government is taking over the governance of healthcare. There has already been significant censorship and control over physicians and what they are allowed to say. And many physicians have faced having their licenses removed because they have tried to protect their patients and have been told by the government that they do not have that right to do that. So refusing to allow medical exemptions, refusing to have discussions about if something is safe or not. So now we are moving into extreme measures of our government pushing into the healthcare realm, and they are creating a set of rules that are going to further restrict and punish anyone in the healthcare profession that does not comply with what they say you're allowed to say. The public at large has been reacting to this and have been letting all their MLAs know that they are in opposition to this bill. I'm just going to let my MLA know, Brittany Anderson, if you vote for this, I will do everything I can to get you recalled. So,
there is so much that is, so many red lights going off with what you just said there. I mean, if we look at vaccine mandates against healthcare workers still ongoing in British Columbia, we saw that all these bodies, the licensing bodies for the doctors and the nurses, they were all basically acting as though they were just an arm of the government anyways. But now if this bill passed, it literally would be that. I mean, just 6 is so much more easy to control. And then when you're appointing anybody in that, I mean, that's quite the monopoly. And so it just seems, I don't know. It's like what I've already covered, people saying they think they're going to do. They think this is what the government is trying to do, have that complete control. And now we see it just about to happen. Now, you mentioned your MLA. You mentioned that people are reaching out to MLAs. Have you had any MLA step up to bat for you guys? We have so many issues in our healthcare system. It's so understaffed, and here you guys are. Are any MLAs doing anything about this?
I haven't encountered any. I have encountered some that are stating that they are trying to raise opposition to not just this, but to other issues. And they are just getting run over and bullied by the NDP government. They are not being allowed to speak. You know, even the fact that Shirley Bond with the Liberal is, she's the one, and another Asian gentleman, I didn't get his name. You know, they are just picking away at every item and item, highlighting the issues that are stated in these points that the NDP government is trying to push through. And they're saying these are ambiguous. There isn't clear definition. You're instituting a whole realm of basically punishment if people do not follow what the government says. And how does the government have any input into how healthcare runs, or understanding the medical system? They are politicizing the healthcare services that we have. And since they have been doing this in the last year, we can see the repercussions of that. We have never been in such a poor state of service to our province. And it looks like they are continuing to expand their influence. And how will we ever recover from this after they have thrown all these bombs into it? Now, another point I wanted to bring up is that when these mandates occurred, the private healthcare sector was not impacted. They are not paid for with government funds. They run their own business. So like dentists, GPs, and contractors. Right. So all of those sectors were able to protect themselves, and this mandatory vaccination did not apply to them.
It almost did. It almost did. They got threatened by Public Health Officer Dr. Bonnie Henry. They said, "You better get your vaccines or else by this date."
If people are in our healthcare system and not recognizing the importance of vaccination, then this is probably not the right profession for them, to be frank.
So yes, we've already talked about in long-term care that people who aren't immunized will need to take additional infection prevention and control measures, including masking, and in all areas where they're providing services to residents, and will need to be tested on a regular basis. And we are working through that. But first, we need to give everybody the opportunity to be immunized. That is really important in healthcare. And I have very little patience for people who aren't immunized in healthcare. And that will be, we've had a vaccinator mask policy for influenza. We will have a very similar policy that if people choose not to be immunized and you work in healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that decision.
And she backpedaled, and I'd love to know exactly why. But anyways, go on.
Because they really didn't have any leverage. With us, they control our wages. With them, they do not. But now with this new amalgamation of colleges and the government taking over control of it, the protection that private healthcare had is going to disappear. So now the part of healthcare, alternative healthcare, that was still functioning independently in this province is now also going to come under the dictatorship of Adrian Dix. Now, we've already had a mass exodus of, I know many nurses who have had to leave the province in order to survive.
I do as well.
And here we are going to have the rest of our available resources are going to leave because there is extreme flags and anxiety over the fact that our government is just so hell-bent on controlling everything about this. So that's our, we're just saying, okay, it's time to pay attention now. It's time to pay attention now.
There's a new sheriff in town in this province. We have a new premier, Mr. David Eby. What about him? I have not seen any talk about this when it comes to whether or not our unvaccinated healthcare workers should be back to work like the rest of the world primarily. Have you seen anything or heard anything about his stance on this?
I haven't heard anything, but I got 2 emails yesterday and I have not had a chance to further investigate it. Okay. But there are bills that are coming up in January which have components of seizure of assets if there is any concern.
Yes.
So I haven't further investigated that, but I knew for sure that once they put this one through, there was going to be a long list of things that they were going to do next.
Comment below. Let me know what you thought of Corinne Maury's thoughts. Some say, what's the big deal? These regulatory bodies were able to make policies before, and some say this isn't looking too good for the future of healthcare in British Columbia. I'm Drea Humphrey for Rebel News. You can find out more details about this story you just watched by clicking on the link to the full written report in the description below. And if you want to help doctors preserve their hospital privileges so that they'll be able to practice even if such mandates drop and they are unvaccinated, please help Dr. McAllister win this fight to preserve his privileges by going to saveourdoctors.ca.